Hello and welcome to this tutorial video for Augmentative Alternative Communication AAC for occupational therapists. AAC is a tool utilized for functional communication for the pediatric and adult populations across the nation. It can appear very daunting for many clinicians, so this video is made to help ease those nerves a little bit. In this video, we're going to go over two widely used programs. That's going to be Proloquo to Go and Touch Chat. Within this video, we're going to go over what AAC is and its expectations, as well as the organization of those two common apps, and then activating guided access with the iPads and program-specific features. So here's just a quick little summary on what AAC is. It is augmentative alternative communication. There's unaided AAC, which means that there are no external tools used for functional communication. This can include gestures, facial expressions, ASL, and more. Whereas there's aided AAC, and that is where there is external tools used for functional communication. And there's three different types. There is high-tech, mid-tech, and low-tech. And across the board for all three of these, there are two different ways for accessing. There's going to be direct access, which means that a person uses a part of their body or the tool to select a button on the device. Whereas indirect is when a person selects a specific target from a group of choices. A lot of times you'll see this with switches. When using AAC in a session, occupational therapists and speech-language pathologists model without expectation. I don't know about you, but I'm not perfect during verbal communication, so we should not expect perfection from AAC users either. So here are 5 tips for modeling without expectation. Pause here to read more. It is important when we are modeling with AAC devices that we empower the usage rather than taking over the conversation. Oftentimes, many AAC users become passive within the conversation or limit initiation since clinicians and other communication partners may take over. So one strategy to keep in mind is 4 comments to 1 question. This will increase modeling opportunities and decrease any sense of anxiety or overwhelmingness. At the end of the day, too many questions can limit the language with the device. Guided access is a feature for Apple products, so it temporarily limits the iPad or iPhone to 1 app. So in this case, we'd be limiting it to only using the communication app. Say you want to double check that guided access is on. Go to the Settings app, then find Accessibility. After that, you'll have to scroll down and find Guided Access. Once that is all on, all you have to do is triple click the home button or the side button once you're in the communication app. So just a couple of reminders here on guided access. There's generally a passcode for it, so ask the speech-language pathologist or parents and caregivers prior to your session. To start and stop guided access, you have to triple click that home button or side button. And then lastly, always work with a speech-language pathologist if you think guided access would be beneficial for the device. So first, we're going to talk about Proloquo and Proloquo to Go. Both Proloquo and Proloquo to Go use the modified Fitzgerald key for color coding. One thing to note as well is that the white boxes are actually folders, and these folders act as categories, and they'll take you to additional words beyond that page that you are on or the core board itself. So you can pause here and look at the color coding key. So now we're going to explore some important settings and features of Proloquo and Proloquo to Go. First, we'll be using that search button during navigation, basic button display, and access method. In a session, there may be times where you want to model with the device but can't find the word. So the next example we'll be going over using that search button. To find the search button, you will need to go to the bottom left corner where there are 4 squares on top of each other. Click that. Then you'll find the magnifying glass. You're going to click that, then use the keyboard to type the word you're looking for. Then the Proloquo program will help you find it.
I want. Bevel. I want bevel.
There are a few basic button displays that are important for occupational therapists, and these can be found in the settings symbol in the bottom right corner. It'll take you to a little page, and there's going to be a lot of different settings, and if you have time, please explore them. But if not, I'll take the time right now to just explore a couple of them. First is the button's appearance. This is with, of course, collaboration with the speech language pathologist, but an OT can help manipulate the button size, the background color, label, and skin tone of the stick figures to really aid those visual skills and access overall. Next, we go back into the settings page and select access method. So within this, there's a couple things to know about. So first is hold duration. Hold duration is how long the button is pressed for in order to select. This is really helpful for individuals who double tap a lot or have decreased motor control. Another thing here is select on release, and this is another setting that activates once individuals pull away from the screen. This can be helpful for individuals who have decreased motor control or tend to drag their hands across the screen. Scanning is an additional setting that can be used when a person requires indirect access strategies. So that was some quick little notes about Proloquo and Proloquo to go. Now we're going to start talking about touch chat programs. Similar to other programs, TouchChat uses a Fitzgerald key for organization. One thing to note is that there are arrows on the top right corner of some of the buttons. When those buttons are pressed, they will take you to additional pages for more words. So please pause the video to explore a little bit more on the Fitzgerald key. Next, we'll be discussing important settings and features that OT should be aware of with the TouchChat programs. First being the screening tool for visual motor skills, second, basic button displays, navigation aids, and lastly, the types of views that you can use on the device. There is a program built into these devices that can be used as a screening tool. So you'll go to select vocab in the left corner, then press choose new vocab, select engage for iOS SS, press open, and then you are there. So you can choose to practice here as well, and you can use it with multiple buttons, shrinking targets, static targets, and even moving targets. So this is super helpful by gathering data on the visual motor skills that are necessary for using the device. We are now going to look at basic button displays. So you'll go to the top right hand corner, and then a small page will appear, and this is an overwhelming amount of settings, so we're only going to go over a few things, but if you have time, please go and explore them. Under page size, there's keyguard inset button. This helps with keyguard placement and border boldness as well. So this is important if the person is using a keyguard. So next, we'll keep scrolling, and there are settings for the speech display bar. This may be important, especially if the person has decreased motor control and visual motor skills. Next, we can keep scrolling and manipulate the settings for button display. This can include activate on release, dwell time, which is also hold time, release time, and additionally, you can make the touch be highlighted by color or even change the background of the buttons. So changing these settings can really help with access and the accuracy of the visual motor skills and motor control of the individual. If this is a device that is used for more than just communication, and in a session you may want to use an iPad app, you are allowed to use split screen or slide over. So you'll select the three buttons at the top of the speech bar and then select split screen. Just be aware if you choose split screen, it only works for some apps, and the communication app itself does shrink in size. Another version of that would be slide overview, and in this one, the communication app does shrink in size again, so just be mindful of that. If you don't want to be in this view anymore, just click the three circles on top of the speech bar again, and then you'll select full screen. Access is going to look different to every single person, so keep in mind they may need a mounting system, key guards, or even switches. So all of these can be found on vendor websites or even local adaptive equipment centers. Thank you very much, and I hope you are able to learn some new tips regarding AAC. If you have any questions, please feel free to reach out.